so very convenient. Let's see.
And what's your title?
Director of Pharmacy
Okay,
at Great
thank you.
Plains Health.
Right. And so I guess for my first question, just kind of tell me when the shipment had arrived, how many doses were in that shipment?
Okay, because of the high level of security around the delivery of the vaccine, we did not receive the actual tracking number and notice until just prior to delivery. It was the only package on the delivery truck. It was flown in and then driven directly to the hospital. We have some security guards and ex-military members on our staff here that helped ensure that security once we knew that it was coming to the hospital. So we were able to make sure that it came in without any incident, and we're able to immediately store that properly in the ultra cold freezer that we've invested in, and that is in a secure location. So these vaccines are very secure and available for treatment of our first line workers across our community and in our hospital, and potentially in other hospitals in the area, as well as we work with the state health department to kind of spread out this allocation to those other facilities. So we'll receive further direction on that later this week on exactly how those logistics will be handled. But it's very, very exciting. This is a historic moment. I remember reading a story about my great-grandfather during the Spanish influenza epidemic of the early 1900s, and being able to relate to his story and see this happening in our time is something that I will be passing down to my great-grandchildren to recognize the historical significance that we're participating in today. And I truly recognize our heroes, our frontline workers who touch COVID patients who are receiving this vaccine now. It not only protects them, it protects their families, their loved ones that they go home to.
Awesome. Can you tell us how many doses you had received in that shipment and about what time that was?
Yeah. Let me recover. So Great Plains Health is one of 8 hospitals across the state of Nebraska to receive part of the allocation of vaccine for COVID-19, and we're very excited to be part of that group. We received 975 doses, and surprisingly, that fits in a very small package. The vials have multiple doses in them, and so we're able to draw those out and be able to get those set up for administration to our frontline workers. So there will be at least 975 doses. We're not going to waste a single one. Every dose will be administered to a frontline worker, and we will coordinate that. It's kind of tricky because there's a lot of storage conditions once it's withdrawn from that ultra cold environment. It can only be refrigerated, unreconstituted for 120 hours. Once it is reconstituted, the clock is really ticking. We only have 6 hours at room temperature to be able to make sure that those doses get administered and that nothing gets wasted. So it's a very time step process to make sure that we get all of those doses utilized and nothing wasted.
How long can you keep it in the freezer?
So in the freezer, it is actually good for up to 6 months, which that's the time span. That this vaccine was just developed, and so we really don't have all the answers to the long-term things that we need to know about it. But we do know that in the short term, there's been very minimal side effects, adverse events. Things have been very well contained, and it's interesting to me that the first thing they do with the vaccine is they test it for safety, and that is the priority first, is the safety of the vaccine, and then they start to look at